A new book encourages tweens to be their own boss when it comes to staying fit and eating right. Be fit, be strong, be you. Teaches youngsters effective and easy-to-use skills so they can take control and develop healthy self-esteem. Timothy Culbert is the medical director of the integrative medicine program at Children's Hospital and Clinics of Minnesota, as well as the book's author. We welcome you, sir. Thanks for being here, Timothy.
Thank you for having me.
Well, doctor, first of all, tell me about what's going on there at the integrative program. Some great things you're doing there at Children's Hospital, and one of the few, right?
Yeah. So we currently are the largest, longest-running program in the United States in terms of complementary medicine for kids. We call it integrative medicine. We've had a great time there. We offer inpatient and outpatient services, and as well we do research and educational projects.
And your background is not in integrative, though. But
I'm a developmental behavioral pediatrician by training. So for a long time I've worked with kids with a lot of different kinds of disabilities, learning problems, emotional disorders, etc. But I think the biggest focus for me over the years has really been thinking about what can we do besides offering kids medications. I think that there's been a big focus in this country actually on medicating kids, and I think beyond that there are a lot of other really good, really healthy things we can do to help children.
And we're seeing, but just some of the stats we're seeing that I've seen here. ADHD has grown from 250,000 in 1975 to 4 million in 2010. Yes. Autism is 10 times more prevalent today than it was in the 80s, of course. Childhood depression has reached epidemic levels in the United States, and
yes,
American children have the most psychiatric illnesses in the civilized world. These are true stats.
Yep. So when we look at diagnoses, I think there's been this tendency to want to pathologize kids that have, let's say, difficult behaviors, put a label on that, and then medicate them. That's kind of been the way we've gone with some of this stuff. And I really think that's wrong. I think a lot of kids, these are variations. And I think the other issue is this. I think a lot of kids are just responding to their environment. So, for example, kids nowadays have a lot of problems going on in multiple domains of their lives, I would say. Environmentally, nutritionally, traumatically, and otherwise, kids are experienced to a lot of physical and emotional stresses, I would say. And so one of the ways we see that play out is in either bad behavior or poor behavior, or more recently we're seeing this issue with the obesity epidemic. And I think a lot of these things are this issue of the interaction of the child's kind of talents and skills and preferences to the environment that they're in, and kind of that interface. And what we're seeing is it's not a very good fit for some kids.
Yep.
And sometimes the outcome is they look depressed, or they look like they are inattentive, or in some cases I think they eat because they're unhappy and then they become overweight. Also, a lot of kids, by the way, are more sedentary nowadays. Instead of trying to get out and exercise and be active with your buddies, we have kids plugged in front of video consoles, yep, and playing with their cell phones all day.
And so you're saying be fit, be strong, be you, and this is what the book is all about. And you're talking about the kids to be the boss of their own body, right? And there's so much self-regulation that they can do.
So I think the other issue exactly is that with even when we make these diagnoses and notice that kids are overweight, which puts them at risk for health problems, what we want to do is give them the message not that you must go on a diet and you must get exercise and you must do this and that. We want them to get excited to do things for themselves.
Yeah.
And so the idea behind the book was to say, what are the self-care skills you can teach kids that are struggling with overweight and sedentary lifestyle habits, and how can we help them to get much more active and engaged in their own health and wellness? I think the book tries to do that in a lot of different ways.
And it lays out really nice for the tween age set, too, the way it is laid out.
It's kind of fun. The graphics are good. And so we talk, for example, about things like acupressure point stimulation, pushing on spots in your body that can actually suppress your appetite. We talk about avoiding emotional overeating by learning things like meditation,
yeah,
and actually using meditation while you eat.
And what all the different vitamins, yep, do for you, and so
great
much more.
Vitamins and nutrients.
What your body needs, for sure. All right, Dr. Timothy Culbert, wish we had more time. Thank you so much for being here.
My pleasure.
All right, the book is called Be Fit, Be Strong, Be You. You can buy it directly from Free Spirit Publishing or at Barnes & Noble or Amazon.com. For more information, just visit us at care11.com. We'll be back after this.